All right. So we are live. How's it going, everyone? It is me, Dr. Roger Sahoury. And look, right now, it is a time of hysteria. It's a time of hysteria. And we have this pandemic going on in this world, and it's time to change the conversation. I mean, you hear everyone's talking about the strength of the virus. And look, are there people that are dying? Yes. Are we praying for them and their families? Absolutely. But there are also a lot of people who are living, actually a lot more that are living, okay? 99% more that are living approximately, okay? But we got to change the conversation from the strength of the virus to the strength of the host, the strength of your body. See, innately, you were given this intelligence, this wisdom to be able to fight off infections, to be able to fight off viruses, as you've been doing for your entire life, right? You've been fighting off infections, you've been fighting off viruses your entire life. One thing that we do know is that there are 3 levels, okay? So there are 3 levels. When we talk about these 3 levels, level 1, which is the lowest level, which is the treatment of disease, okay? Treatment of disease, everybody knows what that is, right? These are people who have a disease process and they're being treated by, medications, right? But how did that disease process ever happen, right? Was it because you were being so proactive in life, or was it neglecting life? Was it making bad choices, bad habits? Was it being in the wrong rhythm, right? Was it, stuffing your body with the wrong type of foods? Look, we know that today, right now, with the pandemic that we have going on, with the coronavirus specifically, that people that have normal BMIs, body mass index, are the ones who are less likely. The people who have higher BMIs are more susceptible of having something really serious happen and possibly die from the coronavirus, okay? So we know that. There's been nobody who has low BMI that has died from the coronavirus. Everybody who's died from the coronavirus has had high BMI. So really important to understand that. And that's why we got to make the right choices. Level 2, prevention of disease, right? Prevention of disease. What are people doing? Social distancing, washing hands, doing those type of things, right? That's prevention of disease. But the conversation isn't happening about promotion of health, building this healthy host. See, promotion of health is where it's at. Like, where are you right now? Are you living in treatment of disease? Are you living in prevention of disease, right? Where you're just locked up in your house completely, like 100%, like not even going for a walk outside? Or are you living in a promotion of health? So even if you are locked up in your house, are you making better choices? Are you nourishing your body, following like a sprint set eating lifestyle? Now, that's about getting your body what we call a state of autophagy, where you're cleaning out the cellular inflammation, detoxifying that body, eating foods that are going to begin to build health, not create disease, not clog the body, but build health. And if you want to learn more about that, we can get into that at another time. But where are you living? Are you living in that treatment of disease, prevention of health? Prevention of disease or promotion of health? I want you to ask yourself that question, because it's time to begin to live in that state of promotion of health. If you begin to do that, what's going to happen? You're going to begin to strengthen your body and your immunity, because if you're living in that state of disease or prevention and you're in that fight or flight and that stress response, your sleep's probably being affected. You're not getting REM sleep. We know we have poor sleep. What's that going to do? It's going to suppress the immune system. If we're living in a state of stress, what's it going to do? It's going to suppress the immune system. We know that there are different stressors: physical, chemical, emotional, and we know that they are controlled by your thoughts, toxicities, traumas, and today technology. And look, if you're technology, for example, if you're on computers all the time, you're on your cell phones all the time, you're looking down, you're creating stress on your body. It's getting tense. If you're getting tense on your body, you're also suppressing your immunity. So you want to begin to do things to build your health. And it's an inside out process, not an outside in, right? It's about building the health from within. So let's make sure that you begin to focus on that. Now, look, what I'm doing right now is I'm offering virtual consults for people who haven't been to the practice or people who are patients of the practice and just don't feel comfortable coming in, even though we're following CDC guidelines. And I'm happy to jump on and give you a bunch of immune supporting tips and guide you in any direction, from supplement support to what you can do as far as stretching and movements at home and traction and rehab and all those type of things. I can give that to you virtually. We can have that conversation until you feel comfortable coming in. Okay. And for those who aren't patient yet and you'd like to have a conversation, I can absolutely have that conversation with you, and we can start the process now and then move it into the office. Now, those who feel comfortable, let's get you set up to coming into the office. Okay. We'll get you set up to come into the office and have an examination. And if you're already a current wellness member, I got to tell you, we are practicing complete safety in the practice. When you come in, we'll take great care of you. We'll give you an incredible adjustment. And this is the time to begin to get more of those adjustments so that your health can do what? Get stronger. All right. So look, on the bottom right here, you can call or text 201-265-0555 to schedule. So just right here, call or text 201-265-0555 to schedule. And I'm happy to help you either virtually or in person. And we're looking forward to seeing you. God bless you. Mwah.